This is a presentation on sleep apnea surgery, put for understanding of surgery, the operative and non-operative management, and how to manage yourself before and after surgery. Apnea itself is stoppage of breathing, and hypopnea is in reduction in breathing. Apnea-hypopnea index is the number of times that you stop breathing. This can be varying in different parts of the sleep, and this will be carefully evaluated before surgery to see how badly you are affected. The aim of the operation is to, one, improve the apnea-hypopnea index, and the other thing is to improve your symptoms and reduce the cardiovascular and respiratory risks that you may have due to your sleep-disordered breathing. In summary, the reason for sleep apnea is a collapsing airway. The airway opening is dependent on the static or integrity of the bony structure that you have, and also the integrity of the soft tissue structure that you have. When the collapsing forces of the soft tissues are a lot higher than the dilating forces, in different parts of the sleep, particularly during your deep, rapid eye movement sleep, you can have sleep apnea. So the aim of the current consultation is to understand the severity of your sleep apnea through a sleep study, to carefully assess your anatomy, to look at the impact of sleep apnea that you have, look at the sites of obstruction, and to see if there's a surgically correctable airway and what type of treatment options that may be available for you. In the process, we will be educating you of your treatment options and also take your wishes into consideration in providing you treatment options. During your examination, we will look and see how significant your tongue obstruction is. Often in sleep apnea patients, you have a bulky tongue that collapses backwards. Some people can have large tonsils. You will undergo a fiber optic examination to see if there is a collapse at the hypopharynx or the back of the throat, which can be due to the tongue base, the side walls, or the epiglottis. Then it's a matter of making a decision. CPAP treatment or a positive airway pressure device is the gold standard if that can be tolerated. But unfortunately, greater majority of the patients do not like to use one or fail to use one longer term. The other options include a positioning device of the jaw or a device to position you on the side to make you sleep on the side more. If all of those fail, we will discuss possible surgical treatment dependent on your anatomy. The first thing to realize is that the surgery has come a long way over the last 25 to 30 years. However, surgery does not remain a simple option for sleep apnea. The surgery can be divided into bony framework surgery, where you either bring the jaw forward or the hyoid bone forward, where the tongue is attached to. In certain situations, maxillofacial offer maxillomandibular advancement surgery, which is a big operation to try and bring the facial structure forwards. The collapsing tongue base can be improved with some of the above mentioned operations, but also soft tissue surgery to reduce the tongue, either ultrasound or endoscopic guided, and in certain situations with robotic surgery. Once again, they are open techniques and quite involved. For the soft palate or the dangly bit at the back of the throat, there are different operations that's been described. And the older style operations, which involved resection of the muscles a lot, increased the scarring and reduced the longer term benefit and also increased the risks of surgery. This surgery has become much more fine-tuned and advanced over the last few years. The paper in 2013 in Australia, as well as the European papers, have described much better surgical techniques to improve the oral and the pharyngeal airway to improve sleep apnea. So what do we do and what are our results? The first thing is to understand your airway anatomy. So here I'm drawing the soft palate at the back of the throat, and then the tongue, and the tonsils on the side of the throat, as you'd see if you look in yourself in the mirror. And the shaded area is the airway amongst those structures where you breathe through. The issue that we have in sleep apnea patients, however, is often when you look in the mouth, most of what you see will be the tongue due to a very high riding tongue. As a result, their airway, which is the shaded area, is hardly visualized. So what we do involves improving the oral airway. So once again, here's the soft palate, then the tonsils on the side, then the tongue would be at the back or the bottom, which we have not included in this picture. On the side of the throat is a raphe or a fibrous thickening called the pterygomandibular raphe, which is between the lower jaw, which I'm just drawing, and the upper jaw. The surgery involves making an incision or a cut towards the pterygomandibular raphe of the muscle drawn. The tonsils need to come out to expose the back muscle, which is hidden behind the tonsil. That muscle also is incised and thereafter channeled through the other muscle that's been already cut to give a lift and also to bring the soft palate forward at the same time. So by having varying suture techniques, what you're doing is you're lifting the palate up and widening the throat. The resultant effect is essentially a widened, more of a square-shaped airway. Now, if you look at where the tongue is, the tongue still can be riding high. Therefore, we do tongue channeling, which is a much more gentler technique to bring the tongue down. This is done by a device called coblation to gently melt the tongue tissue and also to shrink the tongue. If you look at the side view of the same position, here's the nose, the mouth, and the jaw, and the tongue, which is riding quite high, as you can see, and the soft palate, which is hanging down. The narrowed airway can be improved by bringing the tongue forwards and lifting the soft palate up. By doing that, you're opening and widening the oropharyngeal airway where the sleep apnea mostly occur. Snoring occurs as a result of fluttering of the airway in that region. So a little bit more about to describe the tongue channeling mode. Tongue channeling is done by plasma wands, which is a device to shrink the tongue musculature gently. It's not an open technique or open resection, hence reduces the morbidity or the illness following any open resections. It gently melts the tongue tissue a bit like liposuction. We place these channels in predetermined areas to reduce any risk to the neurovascular bundle, though very small risk remains with any surgery. Our preliminary data revealed a significant reduction of the AHI. If you remember, AHI is the number of times you either stop breathing or significantly reduced breathing. We have found about a 70% reduction overall, and even in the difficult patients in our preliminary study showed about a 60% reduction, which is very, very good. The subsequent study revealed a slightly less reduction in AHI, but much improved sleepiness score in these patients. The sleepiness improved from 13.93 down to 5.29. So overall aim of the operation is to make a patient more medically stable, not purely to cure sleep apnea. It also aims to improve their symptoms and hopefully reduce the degree of snoring, though that is not the primary aim of the operation. If someone wishes to undergo surgery for snoring alone, it's important that they bring their partner with them to discuss the reasons and the indications for surgery and to carefully select the surgical options if it's suitable. The next part of the discussion is the consent and the documents, which will be represented to you after the consultation if you wish to go through and reinforce the information that you have. All this information is available if you wish to contact my rooms. Thank you.